Joint. Which type of joint? What type of joint? Hip joint? Ball and socket variety of the synovial joint. Which is acting like a ball? Which is acting like a socket? Okay. Head of the femur acting like a ball, acetabulum acting like a socket. Where these two are articulated to make a joint. That is a ball and socket variety of synovial joint. The mainly flexion, extension, adduction, abduction. Okay. So here, before going to reach to that joint, we can remove one by one. According to the Cunningham textbook, they are given. First you tie the femoral vessels and nerves. First you tie. Before doing the surgery also, if you want to do somewhere, you tie the blood vessels. So to lose that blood. So here also, we can tie the neurovascular bundle in the femoral triangle. What is the neurovascular bundle here?
Femoral artery,
Femoral artery, femoral vein, femoral. See, this is a femoral nerve. Femoral nerve. This is a femoral artery. This is a femoral vein. So these are the first you tie these three structures: neurovascular bundle, femoral nerve, femoral artery, femoral vein. Okay, sir. Now we are tying this neurovascular bundle before cutting. One is the femoral vein, femoral artery, femoral nerve. Okay, we are tied. So now we are cutting just above this. Before cutting, you keep this forceps. Tie this and cut these three structures, neurovascular bundle. Okay. Now, then after cutting this, you cut the sartorius origin. Where it takes origin? Anterior superior iliac spine. There is given in Cunningham textbook. Should cut this sartorius from the origin. Okay. Then after rectus femoris origin. Where it takes origin? Above the acetabulum, anterior inferior iliac spine. So we are cutting this from the origin. Okay, this rectus femoris. Next, tensor fascia lata also there here. We can cut this tensor fascia lata. So next, what you are identifying here? After cutting all this neurovascular bundle, we are lifting this from here. See this neurovascular bundle. Here two arteries are visible. What are these?
Femoral artery and profundus.
Yes, this is the femoral artery. This is the profundus femoris artery, femoral vein, femoral nerve. Don't confuse at the time asking why. What are these two? One is the femoral artery, its big branch, that is the profundus femoris artery. Now we are lifting this neurovascular bundle from this femoral triangle. Okay, next, what are the muscles we are identifying here? Floor of the femoral triangle muscles.
Iliacus, psoas major, tendon, pectineus, adductor longus.
Adductor longus. So first we will remove this iliacus and psoas major. They are given in textbook, Cunningham textbook. From the insertion you take the cut, not origin. Why? All are we cut from the origin. Why we are not choosing the from the origin?
Movement is from insertion to origin.
Yes, its origin is inside. Iliacus takes origin from the hip bone, so it is not possible to cut from the origin. And psoas major also, it takes origin from the lumbar vertebra. It is not possible. So that's why we are taking the insertion from this. What is this? Where it is insertion? Floor muscles. Kidhar?
Hip bone.
Lesser trochanter. Lesser trochanter. So this is a lesser trochanter insertion. So we can feel here lesser trochanter is there. Okay. After that, below this, we can identify there is one bursa is there in given. We can finding that.
Synovial bursa.
Next, we are cutting at the pectineus. This is the pectineus. Next, what are the muscles present in the medial compartment muscles?
Adductor longus.
Adductor,
Brevis.
brevis, longus, and magnus. Gracilis also. Gracilis. Muscles, what are you identifying? Capsule. Capsule is there. White color capsule. Capsule. What is there? 3 ligaments are there. What are the 3 ligaments?
Capsular ligament.
Iliofemoral, pubofemoral, ischiofemoral. So like this. One is from the pubic bone, then intertrochanteric line insertion. Another attachment ilium to intertrochanteric line. Another one ischium to intertrochanteric line. So only here the mainly iliofemoral ligament. It is shape is there Y-shaped structure. Y-shaped structure. It gives more strong support to this hip joint, strongest. Next another one pubofemoral ligament. But ischiofemoral very less and ill defined in the iliofemoral ligament. It is there. Iliofemoral ligament. Iliofemoral ligament. We can also feel this iliofemoral ligament. Thick band. But then immediately head of the femur is exposed. Student. After lifting this, head of the femur. Are you seeing the head of the femur is there? So it is the head of the femur. Okay, now iliopubic. So now cutting to the iliopubic ligament towards the pubis. This is another second strongest ligament to give the support to this. So now I am separating this capsule. This is a iliofemoral ligament, and here it is the pubofemoral ligament. Pubofemoral ligament. Then capsule is there separating. See here, head of the femur. Is it visible?
Yes.
So after cutting this middle side, pubic pubofemoral, and above is the Y-shaped, that is the iliofemoral ligament. So posteriorly it is there, that is the ischiofemoral. So now, don't abduct. So now, if you want to see the acetabulum and its articulation, then we will do slowly abducted. It come outside, the head, how it is come outside, just see. Okay. So I can cut this ligament, not need. It gives the not visible. Is it visible?
Head of femur system.
The fluid also coming out. See how it is come outside. Feet of the fovea, it is visible. That is attached by the ligamentum Ligament of teres. So now I'm cutting the medial support muscles and this. Wait, 1 minute. Don't do it like this. So now I'm cutting this.
Capsule.
What are the attachments remaining here? Greater trochanter attachment. What are the greater trochanter attachments? One is the gluteus minimus and medius. So now I'm cutting that dose.
Obturator externus, internus, and iliacus. Iliacus అవి వచ్చింది రెండుకి and
See, just do abduct. See there, feet of the fovea. Yes, sound it is coming, no? So now I am cutting feet of the fovea.
మన camera.
So the ligament separated. Pattukunnadu. So somewhere it is attachment is there, like a capsule here. Here also capsule. So see of the fovea. This is a ligament. Now I am separating this teres ligament. Okay, separate हो गया. देखो teres ligament. Okay, somewhere some attachments are there posteriorly. Just pause it. See, there is attachment is there. See, now I am separating. See, it fully separated. This is a teres ligament. Okay, there is a capsule covering. Okay, now it was separated. Just lift it. Gluteus maximus is there. Here, what is this now? Sciatic nerve. Okay, now it is separated. See how it is. So now hold it. See this heart, feet of the fovea. This is the ligament, teres ligament. Inside, see. See, this is the acetabulum, articular surface, non-articular surface. Here, attached by this teres ligament. Teres ligament separated from the feet of the fovea. So, this is the articular surface. Center is the non-articular surface. What about this? Glenoid labrum type. Sorry, it is a labrum cartilage covering. So head and the socket, ball and socket joint. It is a synovial joint. Okay.
So like this is the labrum.
Yes, labrum.
So
white
margin,
color.
acetabular margin.
This is a margin bone. This is a cartilage covering.
So where is the notch?
Notch. It is present here.
Inside.
See here.
Acetabular fossa.
Oh.
Yeah, center.
Acetabular
Fossa. Yeah, articular surface. So this is feet of the fovea, head of the femur. Okay. So just now, once again I will explain what are the supports and all these. Just revise చేస్తాను. From this pelvis. So here we are identified articular, acetabulum, articular, non-articular surface, teres ligament inside. What is this fluid? Shining synovial fluid. So synovial fluid is there inside this acetabulum. So this is the hip joint. Okay. Remember all this, and posteriorly supported by the gluteus maximus, medius, minimus, anteriorly supported by sartorius, rectus femoris, medially supported the adductor compartment muscles, lateral side tensor fascia lata, and capsule. Then ligaments, 3 ligaments are give the support to this. After cutting one by one all, then we are separating from the acetabulum. Okay, this is about the hip bone. Just go through one by